graduation room tonight. The race to vaccinate people across the United States in time to head off a new surge in coronavirus cases. Dr. Anthony Fauci is warning that cases are leveling off at what he calls a disturbingly high level. I want to bring in our chief medical correspondent, Dr. Sanjay Gupta. Sanjay, Dr. Fauci also warning the coronavirus cases have plateaued, he says, at a disturbingly high level. Once more, young people are eligible and able to get vaccinated. Will that, you think, take care of this issue?
Yeah, I think that would help a lot, Wolf. I mean, we've seen obviously the impact on overall the impact on the vaccinations on vulnerable people, older people. Those are the people who are first in line, and I think that's why you're seeing, despite the fact that the cases have still been around 65, 70,000, we're still seeing a decrease in death rates, 21% down as compared to last week. Now we have to keep an eye on that, Wolf, because as you know, it's a lagging sort of thing. A few weeks after numbers go up of cases, that's when you typically see death rates go up. But I don't think we're going to see the proportional increase in deaths. And now the message is pretty clear. We need to make sure younger people who may think, hey, look, I'm fine, numbers are going down, the weather's getting warmer, I don't need this, they still need it, because it'll help continue to bring the numbers down and keep us in better shape going into the fall.
You think the current vaccines are working effectively against this UK variant?
Yeah, so this has been tested, and this is a really important point. I mean, this is a more There's evidence that it can be more lethal, cause more severe disease, but the antibodies that you get either from having been previously infected or the antibodies that you get from the vaccine, both seem to be effective against this, as well as the California variant as well, Wolf. So that's good news. There is one variant, the South African variant, which is of greater concern. Some of the vaccine trials have shown a significant decrease in effectiveness on that particular mutation. So that's going to be one that we got to watch out for.
The researchers, they say that even before the vaccines were being administered, the mortality rate was actually dropping over time, and that's likely due to better treatments. What treatments are working well against the virus?
Yeah, I mean, that's the thing. Well, we really didn't know how to best care for patients with COVID initially. Is even simple things like putting someone prone on their abdomen and their chest seems to make it much easier for them to be able to breathe and recover. But steroids, well, oftentimes it's your own immune system that is the culprit here. It just overreacts, and if you give steroids, you kind of decrease the inflammation. That can be helpful. Monoclonal antibodies, you and I have talked about that quite a bit. It can be very effective. President Trump took it when he was diagnosed with COVID. But also things like blood thinning medications, because we know this disease can cause blood clots. So blood thinning medications. My point is, we have developed all these new clinical sort of guidelines to treat COVID that we obviously didn't know a year ago.
The key clearly right now is, first of all, wear a mask, stay safe, but also if you can get a vaccine, get it as quickly as possible.
No question. You've been vaccinated, I've been vaccinated. We feel very comfortable that we're not going to get severely ill, require hospitalization or die. The more people that can get the vaccine and feel that same way, as well as decrease the amount of transmission, that's how you bring the pandemic to a close.
Dr. Sanjay Gupta, as always, thank you so much for your expertise. We are grateful. Just ahead, we're going to have an